Well, what a wonderful morning to be here at Kings Gate in Charlotte County. I'd like to thank, we got Representative Grant here. We also have Dr. Joe Pepe, the health officer, Florida Department of Health in Charlotte County. And I want to thank everyone for being here, which we actually have two really exciting announcements to be able to make, and we're happy about that. People have asked me about, there was some type of report about potential travel restrictions on Americans and on Floridians. And I think it's an absurd report that they would be doing that. I think it would be unconstitutional, it would be unwise, and it would be unjust. And if you think about it, restricting the right of Americans to travel freely throughout our country while allowing illegal aliens to pour across the southern border unmolested would be a ridiculous but very damaging farce. So we will oppose it 100%. It would not be based in science. It would purely be a political attack against the people of Florida. And it's unclear why they would even try talking about that. Just look at the COVID situation in the state of Florida. So since December, the last couple months, Florida's cases per capita compared to the rest of the country, 28. 27 other states higher per capita cases. And for the entire pandemic, it's a similar story. Hospitalizations per capita over this time period, Florida ranks 30th. 29 other states have higher per capita hospitalizations. Fatalities per capita for this same period, Florida ranks 42nd. 41 states have higher per capita fatality. So since December 1st, well over half the country has seen much worse COVID results than here in Florida. But all you have to do too is just look at some of the trends. ED visits for COVID-like illness is down 60% in Florida over the last 30 days. That's the number one indicator for COVID spread. Hospitalized patients are down about 35% in Florida statewide over the last 3 weeks. And don't forget, over the winter, Florida peaked at much less level than we did over the summer months. And we were way less per capita than a lot of lockdown states that are always cited as being, quote, the right way to do it. Meanwhile, we vaccinated the most people of any state in the age bracket where most of the fatalities occur, age 65 and plus. We have now reporting about 1.6 million seniors that have received a shot. That's about 35% of our gigantic senior population, which is almost 4.5 million. And we are number one for shots for seniors. We've done 75% of all shots administered in Florida have gone to senior citizens. And the percentages of seniors that have been vaccinated is one of the highest in the country, and it continues to grow every day. And so any attempt to restrict or lock down Florida by the federal government would be an attack on our state, done purely for political purposes. Now, we've had to stand by Floridians over these many, many months, even in difficult circumstances, even when it was not easy to do. We've saved their jobs time and time again. We've preserved small businesses time and time again, and we preserve the right of parents to send their children to school in person. You look around the country, a lot of kids haven't been in school since March of 2020. It's an absolute disgrace. We led very early on that, and we're much better for it. So we've had to stand by Floridians throughout, time and again, and we will do so going forward. We will not back down, and if anyone tries to harm Floridians or target us, we will respond very swiftly. Now, that aside, I got two great announcements that I'm happy to share with you all today. First, as the next step of our vaccination pilot program for homebound seniors that we kicked off last week with Holocaust survivors, as well as veterans from the Bay of Pigs invasion, I directed the Department of Health and the Division of Emergency Management to coordinate with the Florida Department of Veterans Affairs to identify veterans of World War II and the Korean War who are not able to travel to receive a vaccine. And in fact, we were able to kick off this new effort this morning right here in Kings Gate with Kings Gate resident, 94-year-old Captain John Ahrens. Captain Ahrens is a military Mustang. He started as an enlisted seaman in the Merchant Marine back in World War II. He served in the military for 37 years. He served in World War II. He served in Korea. He served in Vietnam, and he also served in the Persian Gulf. It was great to spend time with him. We were able to have EMTs there vaccinating him and his wife. And we think that there are about 30,000 veterans of World War II and 100,000 veterans of the Korean War currently living in Florida. Now, many of them are able to get around, and quite frankly, John is in pretty good shape too, particularly for 94. But you have some that may not be able to do that. They put their lives on the line for our country, and we need to be there for them. And if that means devote these resources on an expeditionary basis, we're going to do that. So we've leveraged our connections with veteran service organizations, the Florida Veterans Council, and other groups that serve veterans throughout the state. And we're going to work to make sure these veterans get vaccinated. And so you can actually go to a website, www.floridavets.org/homebound veterans for more information. And as we get more requests, then we'll be able to devote more resources to those requests. When we were in Aventura, when we did Judy Roden, who was the Holocaust survivor, we had a number of Holocaust survivors that had already been signed up that we contacted through these Holocaust organizations and Jewish service organizations. But then once we did it and it made the news, more people started asking, and so they get added to the list. When we were at the Bay of Pigs Museum, we had the Bay of Pigs veterans. We had a big list of them. They were out there doing it. But then once it hit the news, people started, more veterans from Bay of Pigs reached out. And so I think we'll see similar here, and we look forward to being able to help out in any way we can. The second announcement includes our administration's newest efforts to increase vaccinations here in Charlotte County, beginning with the vaccination site here at Kings Gate to vaccinate 3,000 seniors aged 65 and over the next 3 days. The seniors will receive the Pfizer vaccine and will be able to come back to the same spot for the booster shot in 21 days. All appointments were handled by the Kingsgate community, so we thank them for their partnership. In addition to this site, we increased Sarasota County's allocation of vaccines at the state-supported vaccine site located at 23400 Harold Avenue, Port Charlotte, Florida. The Charlotte County by 600 vaccines. So that's going from 2,000 to 2,600. And basically what we have been doing is looking at the number of seniors in each county and then the percentage of seniors that have received a shot. And what we found last week was Charlotte, Sarasota, and Manatee were between 20 and 25% of the seniors had received shots. But we had other counties that were 40, 45, and 50% of their seniors. Palm Beach was high, Leon was high. And so we've had to devote more resources, or I told them to devote more resources. So Sarasota got increased, they got plussed up. Charlotte is getting plussed up with their health department. And then obviously these 3,000 shots we think are very good. So we want to be able to increase this. Now, 22% of seniors is actually pretty good compared to other states, but within Florida, we have many areas that are 50 and even 55%. So we want to get those numbers up here, and we're going to continue to send vaccines to the places that need it most. Want to thank the folks here locally for working with us, and we look forward to continue to meet the demand that we do. So we're about 75% of all the vaccines in Florida have gone to senior citizens. We have over 35% of all seniors have received at least one shot, and we're approaching, the reporting is about 1.6 million seniors, but as we know, they're still adding shots from last week. You look back some of those days last week, it was 130,000 shots between the first and second dose in a single day. You go back 5 days ago, would have been less than that. So they keep adding. So I think we're a lot closer to 2 million seniors than that report would say, but that'll bear out over the next few days. But bottom line is we're going to keep up the momentum. We understand there's intense demand for this. The more seniors we do, the more the demand may soften a little bit. And then as soon as we see that a sufficient number of seniors who want it have gotten it, then we can look at expanding to potentially other age groups or occupations or what have you. But this is really, really important. We've got to continue. If we're getting 300 to 325,000 shots a week for first doses, we want to be adding hundreds of thousands of seniors every week getting shots, and that's going to be our goal from here on out. We've also done things that some other states are starting to mimic, like doing events at houses of worship. We've done 45 events in the state in conjunction with houses of worship. It's done about 35,000 vaccine shots at those events. We've also done it with multiple faiths coming together in one. We also have 105 community vaccination sites, and these senior community visits, we've done 15 of these throughout the state. Yeah, we started at Kings Point down in Delray Beach was the first one that we did. We've done Sun City Center, now here in Charlotte County. So these are great opportunities to get in where you have a high proportion of seniors, run as many thousands of seniors through in a convenient way right in their neighborhood close by. So we'll be doing more of these next week and look forward to being able to do that. And we probably will do one in this part of Florida as well. We also now have more retail pharmacy opportunities for folks. So we have 119 Walmart and Sam's Club stores across 34 counties. So starting tomorrow morning, you're going to have seniors being able to get shots at all those Walmarts. Now, that's not every Walmart in Florida, but it's about 30%. And they got a lot of stores here, so that's going to be a good starting point. They have not yet done it for Charlotte County, but we're asking them to try to expand in as many counties as possible. But I think that they're handling it right. They're making sure they're doing it right. And then once they get their sea legs, they can expand. But you can still look in other places. You don't have to be from the specific county. Walmart.com/COVID vaccine if you want to try Walmart, and then SamsClub.com/COVID vaccine if you want to try Sam's Club. We also have a big Publix expansion. So we had worked directly with Publix out of our allotment. Now the federal pharmacy allotment, which is more, is going, and there's additional Publix. So we're about 600 Publix throughout the state are now offering COVID vaccine shots. That's 41 counties, and we already had 7 pharmacies for Publix offering vaccines in Charlotte County. We have a number in Lee and Collier. This now adds a bunch of other counties, including counties like Manatee. Publix.com/COVID vaccine to make an appointment. The next window is going to open tomorrow morning at 7 a.m. So if you go on then, you're able to make appointments for the following Monday and Tuesday. And they're going to stagger these appointment windows so that there's not one mad crush. So Friday morning window will be for Monday and Tuesday. Monday morning's window will be for Wednesday and Thursday. And I think that makes a lot of sense, and hopefully a lot of folks will be able to do it. So we're going to continue to work hard. You just can't let up when it comes to the vaccine. So we're going to continue to work. We are hoping that we start to see increased supply of Pfizer. We really haven't seen it. It's been very, I would say, very kind of middling in terms of the numbers. We've gotten more Moderna than Pfizer. So if we can get more, they say they're going to do all these by May. We want to start seeing that because we'll be able to get that out. We just did the Pfizer, John and his wife, when we did that visit. So we want to see more Pfizer. That will help us. And then when the Johnson & Johnson vaccine's approved, that will help us a lot. That's not going to happen until the end of the month. We were hoping it'd be mid-February, but it is what it is. And so they're doing it at the end of the month. But once we get that, depending on the supply, that could make a real difference as well. And so rest assured, we're already game planning ways to be able to get that out and get it distributed in ways that are most effective. Some people are going to want Johnson & Johnson. Some people are going to want Moderna or Pfizer. I would just say this. The data on Johnson & Johnson after 28 days was 100% effective at preventing death or serious hospitalization. So yes, a little more likely to get infected than with Pfizer or Moderna based on the clinical data, but that infection was almost always mild. And so I think it's a really good tool for us, and we're going to want to make that available for a lot of folks throughout the state of Florida. And then finally, I would just want to commend, we saw a lot of great plays in the Super Bowl. We saw Tom Brady connect with Gronkowski, but I got to tell you, yesterday in the boat parade, throwing the Lombardi Trophy, Brady to Gronk, one boat to another, that may have been the sweetest connection of all. So hats off to those guys. Take some questions. Yes, ma'am. Oh, well, we absolutely, we want to get it as far and wide. Yeah, we do have those 7 retail sites, and we did increase the allotment for the county health department, and we're going to keep doing that. If there's other communities that are interested, that have a huge amount of seniors, we want to do it. When you have these communities, just from an administrative perspective, they can get the folks, they can get the signups, and then really we just come with the logistics and come with the stuff. And so it's a good team effort when you can do that. But yes, we want to be involved broader. We want more retail sites in Charlotte County, and we're going to be working to make that happen. Yes, ma'am. Anyone else?
Yes, doctors' offices and clinics are not getting very many. They want to participate. They're like standing really. For instance, one physician said he had 400 patients. All he needed was 400.
Yeah.
He just recently got 40.
Yeah.
Millennium got 1,000, but they have 250,000 patients. They're a big opportunity there.
For sure. So it's a great question. We really do need to get these in doctors' offices. So initially, we could only do to the hospitals and the county health departments. We really led the country on doing retail sites when we did Publix, and that's been very effective. I mean, if you look at Palm Beach County, that was the biggest county we were able to do Publix in so far. They have 60 or 65 Publix. And if you look at the shots that have been done in Palm Beach, they have as many as I think they're almost more than Miami-Dade. And Miami-Dade's got 2.9 million people. Palm Beach is 1.5 million. So that's been very effective, and we want to continue to do it. But when you get it into physicians' offices, they have their patients. So they can just send out a thing, hey, I have 100 shots available, that the patients can come in, they can get it, and it, I think, moves very smoothly. So we started that pilot here in Southwest Florida. We've also done some in Miami-Dade County. I think the question is just going to be the vaccine supply. Everyone that's currently getting vaccine is asking for more vaccine, and that's understandable. Look, a lot of people are doing a really good job getting this into seniors' arms. So the question would be, maybe we get the Johnson & Johnson. I don't know what we're trying to figure out what have they produced so far. They say 100 million by June 1st, which is fine, but what can we do if it's approved on February 27th or whenever the date is? It will ship a day or two after that. They do have some ready. If they have 10 million ready for the country and we get 500,000 or 600,000, that'll make a big difference. That may be something we get into the doctor's offices and then let the physicians do it. We also are going to look at some of the, I know the police and some of these other folks are interested in doing it. So I think that there's a lot of stuff, but I do think it was good. The reason why we did that with some of these pilots is because we want to see how it works. I think it's worked very well, to be honest with you, but it's really just going to be contingent on supply. But once the supply is not an issue anymore, it should really be in every doctor's office. I mean, that's really that. This site is fine, and we're doing this because we obviously feel a sense of urgency to get it for senior citizens. But in reality, you don't set up sites like this for flu shot or some of these other things. It's available. It's available by hospitals, doctor's offices, pharmacies. And so hopefully when the supply is good enough, we're going to be able to do it. I think it'll work out very well. Yes, one more.
What message would you send to seniors who are waking up every morning, trying to get these appointments and still having no luck over and over again?
We're not quitting. Hang in there. We know 4.5 million seniors. We've done probably, there's reported 1.6 million, probably a lot more than that. But we know there's going to be 1 million, 2 million more that really want it. And so, in fact, I had a big meeting yesterday about what we're looking at for the shipment from the feds this week. Where do we get it? Where are there gaps in seniors? Obviously here we're trying to fill a gap in Charlotte. We were in Sarasota. We made sure Publix went to Manatee County because we saw those counties. So we're going to keep doing it. So I would just say hang in there. The supply is still not what we'd like. We're getting what we can from the feds. But I do think it's going to get better over the next couple weeks. And if that's the case, more and more seniors are going to be able to do it. But it is important to note, there is no state in the country that's done even close to as many senior citizens as Florida has done. You know why? Because we put seniors first. That was not what we were told to do by the bureaucrats. But we said, you know what? This is impacting seniors more than it's impacting somebody that's 42 like me, or somebody that's 22 in college. And so we're going to follow the data, and we're going to be there for our parents and grandparents when they need it most. And so we are far ahead of the game because we came out of the gate with seniors first, and we are not going to stop until every senior that wants a shot is able to get a shot. Thanks, everybody. Appreciate it.